breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
Welcome back to this week's episode with Dr. Kolby Condos, Dr. Glenn Harrison. Today we are going to be brainstorming about a condition that affects tons and tons and tons of people, and they might not know why they have it. They might know, that they have it, but it's really severe, and that is migraines and headaches. There is a difference. We're not going to go super deep for this kind of breakdown. We're just going to kind of lump them all in together and break those down. We're going to break down maybe, what you're suffering from, whether it's sensitivity to light, sound, movement, whatever. If you're nauseous, if you're not nauseous, if you have light flashing, we're going to go into some of that. We're going to go into some of the symptoms, or not some of the symptoms, some of maybe the management, some of the avenues that maybe you need to look into if you're not getting the results you want. So without further ado, here's my co-host, Dr. Glenn.
Hello, Dr. Kolby. So yeah, migraines. How about we jump right into them? It's really being a plague. It's a plague. It really is a plague. I've had clients, and I know you have, Dr. Kolby, where migraines and headaches have destroyed lives and families and relationships, and even put people into severe cases of depression. There's some migraines, like, we're not going into this, but like cluster headaches that get so bad that people can't just bear it. So suicide rate is very high. But putting all that dark stuff aside, there is a solution. There's always a trigger or triggers to migraines. So I'm excited to break that down because there's a lot we can do. So let's just jump into it. So causes. I know, Dr. Kolby, you work with a lot of neuro. This is kind of your realm. So from can you, if you can, elaborate a little bit on neurological causes and vascular causes of migraines and headaches?
Sure. So what I want everyone to understand is, like, your actual brain matter and your brain material inside of your cranial vault doesn't actually have any pain or nociceptive fibers in there. So your brain actually cannot perceive pain in itself. But when you have, quote unquote, like a migraine or a headache, what can happen is it can be a pain from either like the arteries inside of your head, inside of your brain, because those actually are sensitive to pressure and stretch and compression and all this type of things. And then you can look at places outside of the brain. Is an issue in the suboccipitals of the neck? Is it an issue with your ability to perceive your environment around you? Is there an underlying, sensory mismatch that happened after you had maybe a traumatic brain injury or concussion or something like that? This is how I break it down. So basically, when I have a patient that comes in with chronic migraines or something like this, I always do an in-depth neurological exam. I do a cranial nerve exam. I do a peripheral nerve exam. I just break down, I do a complete neurological examination, and that can be totally useful. I actually caught a patient who actually came in with complaints of migraines, and during the neurological examination, I actually discovered some signs and symptoms that were like really ominous that you classically see with like an upper motor neuron lesion. And actually it turned out that she had a small brain tumor. So that's another thing that I'm not saying that, you may or may not have a brain tumor, but that's an option. That's where the exam comes into to be really important. That's one time. I mean, I've seen tons and tons and tons of cases of migraines, and I've helped manage a lot of cases of migraines and headaches. That was only one. A lot of the times when I see patients that have unresponding, migraines, they've seen a traditional medical route where they've done like Imitrex, or they've done injections of Botox and stuff like that, and they haven't responded. That's when the neurological exam can help bring out some of those underlying causes, whether it's like that sensory mismatch or, the pain in the suboccipital muscles because their eyes are continuously moving. Those are some really, really big players as far as like what I see with migraines and headaches myself.
So neurological pieces.
Yeah, exactly.
I'll summarize.
It's a case-to-case basis, but it can help you put together a map or, a picture about where you think some of the issues are, and then you can apply some targeted therapies to help manage that. So
Yeah, so I know the argument in different realms of medicine is what's causing the migraine. What are the causes of migraines? Are they neurological, like you talked about, or vascular? Can you elaborate briefly on that?
Yeah, sure. So the vascular issue, I mean, obviously the patient that I had that had the brain tumor, they were actually causing compression in the anterior circulation of the brain. So that was an issue because of that compressive force, and where the tumor was located, is causing severe pain. You can have issues with like where you can have small vessel disease in the brain, where you're getting like ischemic events, so your brain is not actually getting enough oxygenated blood. That can cause some of this stuff. You can have high blood pressure. You can have cardiovascular disease. These are all definitely options as far as like things that might be an underlying cause to migraines and headaches. But then you have to discern like where is it coming from? Is it coming from elevated levels of cholesterol and stuff like that, which we broke down in a previous segment? Is it because you're super inflamed? Is it because your blood pressure is super high? And if it is high, why is it high? These are all things that you just have to investigate, but there are normally some very good reasons and explanations as far as why this stuff is happening. So when I think of vascular, I think, okay, is it an issue with the arteries and veins? Or is it an issue with the heart pumping blood to the arteries and veins? Or is there something compressing the vasculature?
So between either lab tests or physical examination from a neurological or a vascular status, you're going to find it.
Yeah. Yep. I run blood work on pretty much every patient that comes in. If you're coming into my office, I'm doing a full neurological workup on you, especially if you have something like a migraine. But yeah, I do that on each patient that comes in. So
yeah, a lot of what I see in the office, I see a lot of hormonal problems that are triggering migraines and headaches. Menstruating females, right before, right after, even during their cycle, usually more common right before their period, and it's cyclical headaches and migraines. So usually we see a hormonal component where that has to be addressed, and then that ends up being a liver problem because the liver isn't metabolizing the hormone as much, meaning getting it out of the body. So another factor outside, we talk about neurological and vascular, is hormonal disorders. Another one that I see is just metabolic problems, people with high blood sugar, with even kidney disorders, toxicity, driving, and food sensitivities, chronic digestive issues. And as sensitivities, I see that a lot. I see it a lot with dairy. I see it a lot with simple carbohydrates, where all these other irritants are playing on the body. And who would have thought, something so far from the brain could do so much? So I guess to summarize, anything that irritates the brain or the body, which the brain is part of the body, could potentially create a headache or a migraine. Would you agree?
Yeah. I think that's an accurate statement for sure. So say you have, say you are a migraine sufferer, headache sufferer. Maybe we'll go into a little bit about some of the signs and symptoms that maybe you didn't realize that were associated with the migraine. It can be the brain fog, can be like that tight vice-like feeling in your head, it can be sensitivity to light, sound, nausea is a big cofactor with migraines. I mean, the feel like
vision problems. That's a big one.
Visual issues, the inability to drive, motion sickness, all this stuff can be associated with migraines. My wife used to suffer from migraines, and hers was actually hormonal, strangely enough, right? Not neurological. I looked at her, did the exam, like, yeah, no. When I first met her, and it wasn't an issue for her, really sound neurologically. Obviously, she got some small things, everyone does, but hers was hormonal. She did like a liver support and took care of the migraines. But yeah, I mean, these things are problems that really can be debilitating to people. When my wife would have them, she would be on the couch, unable to walk, really unable to move, really, and do anything because the migraines were so severe and the nausea was so significant that really the inability to do anything.
Mm-hmm. And then the medical strategies, for the conventional medical strategies, some of the drugs are so potent that people suffer, tremendously just from trying to deal with the side effects. everything from constipation to depression to anxiety to dependency. Yeah, they're pretty powerful. I know you see a lot of that in your office, right, Dr. Kolby?
Yeah, and Botox is another big one. They do Botox injections for a lot of people who are suffering from like chronic migraines, where they will do, injections in the back of the neck or into the scalp. And some of my patients have benefited really, a lot from that. Others have not benefited as much, kind of a case-to-case basis. But then that doesn't really answer the question for me, why, if it is working, and if that Botox injection into the muscle in the neck is working, why is that muscle necessarily so tight to begin with?
Yeah, the Botox, it wasn't a Botox deficiency creating
Right.
the migraine or the headache.
So if you are suffering from this, I guess what I would look at, and you're not getting any resolution, you're not getting the answers you want, change up your perspective as how you're thinking about what it actually is, and find someone who can investigate the other options. You've tried the pharmaceuticals, you've tried the injections, you tried physical therapy. That's another good option in many cases. Maybe it's actually just a structural issue where you're looking at your phone too much or at your computer screen too much, so it's actually causing changes in the curve of the neck. Change how you're looking at it and find someone who can help you put the pieces in place. Because I had a patient, for instance, that is in her late 70s. She's been a chronic migraine sufferer for 20 plus years. She was referred to me by another healthcare provider. I did the neurological examination when she was in her early to mid 50s. She was struck in the head by a pipe and actually had a traumatic brain injury. And it started after that as a consequence. We did the neurological exam. We found some issues with her visual systems where she wasn't able to actually fix her eyes on the target. And her neck and her head was substituting for aberrancies in that movement. We gave her some exercises to help correct that. Not correct it, but maybe correct it and help manage it. And the migraines went away. After 8 weeks, we got them completely gone. First time that she'd been migraine and headache free in 20 plus years. So there are options. There are different treatment modalities or management modalities. If you can find the right provider. So don't give up hope. Keep looking, keep exploring different options, and hopefully you can get the help that you need.
Yeah, well, that's good. So how do they get a hold of you, Dr. Kolby, for more information?
Yeah, so you can get on our website. Our website is www.northlakeschiropractic.com. You can find us on Facebook. Our Facebook page is North Lakes Chiropractic and Functional Neurology. Dr. Glenn, I know that you work remotely with a lot of these migraine cases. Why don't you go ahead and tell them how they can get a hold of you as well?
Our website's probably the best place. That's where all the information is and all our contact information is. So www.drgharrison.com, or just Google the Center of Functional Medicine Denver, and you'll find us.
Awesome. So again, if you got value from this content, if you feel like you would like to share this content with your friends or family members or loved ones or whoever that suffers from migraines or headache, please do so. Please hit the subscribe button so you get notifications when we're coming out with new content. If this is something that you found valuable, our next one is going to be really, really big because we're going to do a 2-part series.
Yeah.
We are going to break down a condition that really has hit kind of close to home for me personally within the last couple of months. And that is going to be not necessarily me, but for loved ones and people that I'm intimately involved with, and that is infertility. And we are going to break it down a little bit from the female standpoint and from the male standpoint. So if you or someone you know is suffering from infertility, please stay tuned because we're going to break it down best we can and hopefully provide you guys with a little bit of guidance and help. So until next time, my man.
Awesome. Thank you, Dr. Kolby.
All right. Bye.